Welcome to the news belt of the AM show. In our first story, residents of Ekumfi in the central region are asking government to fix long-standing health challenges in the area. They say the lack of a proper emergency center, top-notch medical facilities and poor road networks make it difficult for healthcare officials to deliver optimal care and save lives. There's more in this report.
The Otom Model Health Center of Excellence, which is saddled with a lot of challenges. From a faulty, rickety ambulance that's not been used for more than a year, to a records room that's barely hanging by the thread, and an admission ward that can only house 3 patients at a time, the health center is overwhelmed.
We have a lot of challenges in Otom Model Health Center, starting from the outpatient department, which is the OPD. There are a bit of challenge as in office space. The records rooms are very, very small, very stuffy, and then a consulting room too. They don't have consulting, the couch for examination, and then the detention room, they just have only 3-bed capacity, which is not really favorable because we get a lot of cases to attend to. The laboratory too is very stuffy, and then we lack a lot of logistics for running the lab.
From here, the team docked at the Eswesia Model Health Center of Excellence. Here, we realized the ambulance had also been parked, not functional. The roof leaks badly anytime it rains, and the facility's lab is substandard, making it difficult to do a proper lab test. The standby power plant has also been out of service for a while, forcing healthcare workers to sometimes halt healthcare delivery anytime the power goes off.
We also have challenges with our ambulance. It's not been on the road for some time now because of some engine issues and then some other body works as well. Our plant is also in a very, it needs some servicing, and some we need to look at it because we are unable to work when the lights go out as well.
We are encountering a lot of problems with the issue of biohazards with the space. We also have a problem with our machineries, with the issue of hematological analyzer. We can't do full blood counts.
The situation isn't different at the Nakwa Polyclinic, the constituency's biggest and most modern health facility. No ambulance, small laboratory, faulty mechanized borehole that's yet to be fixed, and a shortage of prime staff makes healthcare delivery here difficult, especially for a hospital that was commissioned quite recently in 2018.
Looking at our water problem, this time around we have a very big problem with water because we don't have water to run the whole facility. We buy water from outside, so it's a big challenge for us. And also the staff here have accommodation issues. It's a big problem because this place is more or less like a village where people don't build houses to rent out. So when we came here, it was very difficult, and we have staff who want to come here, but because of accommodation, most of them finally go on transfer again because there's no place for them to stay and work.
We sought to find out how authorities are solving these problems to alleviate the plight of patients who throng these facilities. Dr. Regina Ahunu Ama is a Kumfi District Director of Health.
The challenges within the district are very peculiar challenges, which I must say are not insurmountable. Most of them have been brought to my notice, and myself and my team, we have contacted our stakeholders, the Regional Health Directorate, the chiefs, our Honorable MP, and well-meaning citizens of Ekumfi. The roof issue at Eswesia, I think the problem is beyond patching up. It's an issue of more or less trying to replace almost the entire roof, and the financial capacity of the directorate and the facility will not be able to do that as at now. So we have contacted our Honorable MP once again in the assembly, and we are hoping for favorable response so that we can be able to curb that issue.
For patients who frequent these facilities, patience is a virtue that may pay off soon.
Now, a Deputy Director of Health in the Northern Region, Dr. Kwame Techi, is advocating for the inclusion of oral health services on the National Health Insurance Scheme. He's worried that 96% of Ghanaian adults between 34 and 44 suffer from gum disease. Martina Bugri has the rest of the story.
Currently, the National Health Insurance Scheme covers some oral health service. However, Dr. Kwame Techi emphasizes that oral health is a broad field that can be costly, necessitating its inclusion in the National Health Service Scheme. Speaking at a celebration to mark this year's World Oral Health Day in Tamale, Dr. Aduayedin said the state of oral health in the northern region is not something one can be proud of.
Plead with policymakers that they help get most of these oral health services on a national health insurance scheme so that it can make it more accessible, especially to people in the hard to reach, in the local communities and also in the private areas. Cover some of them, like cleaning and polishing and some minor procedures. But oral health is vast and broad. You may want to do a procedure that may even involve replacing your tooth, or maybe have to even wear braces. Braces cost a lot of money. People may have certain dentition that even makes them have poor self-image. So all these things, at least everyone can support. We believe that can be made accessible to everyone.
He also stressed the need for resourcing dental units in hospitals to ensure they can provide adequate care.
The oral health indicator in our reporting format, the DIMS, is low. And then the northern region happens to be one of the low-performing regions when it comes to oral health services. And it's something that brings to mind that there's a wake-up call for us to all rise up and ensure that we provide the necessary equipment, we attract dental surgeons and other cadre of dental professionals so that we can help improve access. Looking at the current challenges that we are facing with respect to human resource and also with respect to facilities or accessibility, especially in hard to reach or deprived areas.
Kingsford Bagbin has commissioned the Yamransa Model Lab 14 in Kalio in the Upper West region. He described the state-of-the-art facility as a symbol of innovation and a gateway to a brighter future. The ICT lab is set to enhance teaching and learning in the Nadoli Kalio enclave and connect the area to the world. Over the next few years, about 5,000 students will benefit from the project at no cost. Joy News' Upper West regional correspondent Rafiq Salam reports.
The state-of-the-art facility, established at the request of Speaker of Parliament Alban Summan Kingsford Bagbin and funded by him, aims to advance science, technology, engineering, arts, and mathematics education in his home district, Nadolu Kalio. The project, codenamed Yamransa Model Lab, is the fourth time to be commissioned in 13 regions in the country since its inception in 2016, with plans to expand to the Savannah and Upper East regions through government partnerships. Dr. Diboro Rose is the president of Helping Africa Foundation, who partnered the speaker for the project.
In 2016, at the urging of Mr. Ariaku, we decided to deploy our cutting-edge ICT center design by building at least one Yamransa model center in each of the 16 newly formed regions of Ghana. We are now gathered in the midst of Yamransa Model Lab 14 in the Upper West region of Ghana.
The magnificent edifice is equipped with information and communication technology, ICT resources, multimedia content, a maker space with robotics, augmented reality, virtual reality, learning tools, and 3D printing technology. The 36-seater EduLab also has a conference room designed to provide students with hands-on experience to complement their classroom learning. Project Director and Chief Executive Officer of Implementers, Kafiu Prebier, gave further detail about the project.
In this facility, we do have 4 key rooms Two of the ski rooms have computer labs, which we call the Edu Lab. There's a state-of-the-art computers that consume only 1/10 of the power of a normal computer. The other room is filled with robotics equipment that would help with the creativity of the students.
Speaker of Parliament and promoter of the Yamonsa Moral Lab 14, Alban Sumana Kingsborg-Babwin, who was excited about the commissioning of the project, stated that it symbolizes their collective and unwavering commitment to education, technology, community engagement, and sustainable development.
So when you are in this structure and you assess the system, you can get information on any subject that is desirable in the world, the whole world. So when you are here, e-library is available. E-library, the books that they sell, you can access them. The only thing is, we have done our best to eliminate injurious information. That one you can't access it. Those of you who think that you can come and get porno and all those, you won't get it.
Alban Sumana Kingsborg-Babwin paid laudations and encomiums on the partners, especially Help in Africa Foundation.
This lab represents more than just the bricks and mortar. It embodies the spirit of innovation and the promise of a brighter future. This is a lab where dreams will be nurtured, ideas will be cultivated, and solutions to pressing challenges will be discovered.
There were statements of commitment from the Nodolo District Assembly, District and Regional Education Office, and the managers of the facility to ensure its efficient use and sustainability. This magnificent state-of-the-art ICT facility is expected to give a facelift to the teaching and training of ICT in the Nodolo Enclave and the Upper West region at large. It is expected that over 5,000 students are to benefit from the project. It's actually free. Students who come into this facility are not supposed to pay a dime. Reporting for Joy News, Rafik Salam, Keleo.
Let's talk munitions now. And the National Commission on Small Arms and Light Weapons is rolling out an inventory-taking process of weapons used in musketry and their handlers during traditional events. Partnering the security services, the users of these firearms will be properly trained to handle the arms with the goal of protecting lives and property. As it stands, regulations on firearms are silent on musketry, a situation that has contributed to security breaches during traditional ceremonies. Nanaya Ojima now reports.
Firing of musketry has become an important part of most cultural events in the country, but the poor handling of firearms has resulted in loss of lives and injuries during display. In February this year, a newly enskinned Nungwa Gamukwen was killed during a cultural ceremony. Journalist Kofi Adoma got injured in the eye after charged gunpowder was shot into his eyes. Acting Executive Secretary of the National Commission on Small Arms and Light Weapons, Dr. Adam Bona, is worried about the fatalities suffered during firing of musketry.
One of your colleagues in the media, is it Kofi Adoma also? Someone who is not trained fires a weapon, a musketry, and he has gunpowder, charged gunpowder. Charged gunpowder is different from gunpowder. That goes into his eyes and he has challenges. The Babubulomo, they were outdooring one of their queen mothers. Someone emptied, bullets into the woman. Unfortunately, she also died. It means that people are breaking, doing things that must not be done. In the past, musketries were fired and people were not injured. But today, they are firing pump action guns with lethal pellets.
In dealing with the situation, the Commission has commenced processes to mark arms and offer training to persons tasked to fire musketry. Dr. Bona expects traditional authorities to support the rollout of inventory taking.
So one of the things we are also doing we have spoken to the Gbobu Lomo, and we are going to be meeting the Greater Accra Regional House of Chiefs, the National House of Chiefs, is to start marking weapons that are used in festive occasions, so that you are attired like a media person who is going into a conflict zone. You wear your press dress. So the commission gives you an attire, and your weapon is marked. If an infiltrator comes in, not properly kitted or attired, with an unmarked weapon, we immediately will neutralize you.
The absence of a legal framework to regulate the use of arms has been identified as part of the cause of arms proliferation. The Commission is courting public support for the passage of the arms bill.
The Minister of the Interior, Honorable Mubarak, and the President in his first SONA did mention strengthening legal framework for arms in this country, literally talking about us. And so we have been told that by the middle of this year, May, or tentatively June, the bill will be passed into law. And so we will be visiting, hopefully, the Right Honorable Speaker of Parliament. He traveled by his back, so we'll be going there. Once we leave here, he is likely to be the next person we visit, soliciting all of them support.
The two-day retreat of staff of the National Commission on Small Arms and Light Weapons was to train staff to improve their roles in national security. For Joy News, Nana Ojima, Kumasi.
In our next story, President John Dramani Mahama has announced that government will pay teacher and nursing trainees allowances through the Controller and Accountant General's Department. Speaking during his thank you tour in the northern region, he said this would ensure that the allowance was paid regularly to students, just as the CAGD disbursed salaries to government workers.
There's good news for nursing and teacher trainees. Nursing and teacher trainees allowances are to be paid directly by the Controller and Accountant General. This has been made a part of the compensations item in the budget. This will permanently eliminate the delay in trainees receiving their allowances. This means that anytime public sector workers receive their monthly salaries, teacher and nursing trainees will also receive their allowances. The Ministry of Youth Development and Empowerment has launched technical committees to oversee the execution of the Ejumaura program and the National Apprenticeship program, which were major promises in the NDC manifesto.
Well, up next, we bring you our business update with Sweetie Abochi.
Hello there, let's do business update now. The Chief Executive Officer of the Association of Ghana Industries, Seth Chumakwabwa, has called for practical measures to link research findings to industries to help drive economic growth. According to him, a seamless link will enable the industry sector produce at lower cost to optimize their operation. And he spoke to Joy Business.
We know that our research institutions are doing pretty well, but there's still a big gap between what industry needs, products that we need to solve our problems, and what they are able to research and innovate. They are doing well in the sense that within the limited resource constraint, they are still able to come up with products and technologies. The challenge has been transitioning from developing the products, the concepts, into practical manufactured products. It's always been the biggest challenge. I know CSR, we collaborate with them. They've come up with some products that have been commercialized, which is great, but there are several ones that are still sitting on the shelves, and we are unable to commercialize it. And I guess it's probably because of the weak link between industry and academia.
As part of efforts to reduce the cost and time of trading through the West African countries, Trademark Africa, a leading African aid for trade organization, has launched the Making Trade Work for Women in West Africa project in Ghana. The 4-year project, in partnership with the Canadian High Commission and CECI, will see the commitment of $14 million. Chief Executive Officer of Trademark Africa, David Beer, explained the project, which aligns with Africa Continental Free Trade Area and will boost women-led activities in the private sector.
Trademark Africa, we are an organization that exists to reduce the time and the cost of trading across borders. We have been working in Ghana for 2 to 3 years now in support of the government and the private sector, but also the African Continental Free Trade Area Secretariat. We are delighted to be launching this program with the support of the Canadian government, 20 million Canadian dollars, and in partnership with the NGO CECI, in order to make it easier for women to trade across borders. We believe that it is extremely important that trade benefits all parts of society. This project will focus on reducing gender-based discrimination at borders, working with border officials and traders. It will also enhance Ghana's integration into the AfCFTA and the ability of women to benefit from that. And we will work on improving regional value chains, in particular those that benefit women.
That makes our business stories this morning on the AM News. Back to you, Ben.
Well, thank you very much, Sweetie Awachi. And that's how. But stay. Up next, we're going to serve you the news review. Our guests will join us. We'll be right back.